Colic, derived from the word colon, which was originally defined as severe abdominal pain. Except nowadays, when you hear the term colic, we immediately think of a baby who just cries and cries and cries from an unknown reason. Except we do know because the word itself is telling us where the problem is. But how do we fix it? How do we know where to go? Because in our medical world or the medical in our society right now, colic is seen as something that some babies just do. Some babies just cry. And maybe we can give them some gas drops. Maybe we can stop breastfeeding. That was even a recommendation to a mom before. Um, it's you that's the problem. So stop breastfeeding and baby will be better. Um, Sometimes it's just do nothing because some babies just cry. So all of those things are not getting to the root cause of the problem. Babies are communicating with us all the time in the best way that they can. And I think it's really important for us to start listening. Colic is a medical diagnosis. However, I think that it has become a diagnosis that masks the problem. A lot of times, a diagnosis gives people a sense of relief. Oh, something isn't, my baby's not broken. They have this problem, they have this disease. Um, so, my baby, there's nothing wrong with my baby. He just has colic. Except, no, there's nothing wrong with your baby, except he's trying to communicate to you that something doesn't feel good, that something doesn't feel right. And there are things that we can do. Pushing for a feeding assessment so that we can look at latch and motor function so that we can determine whether baby's just getting lots of air. Looking at an allergy or intolerance perspective and see if there's something that is, because sometimes it's not an allergy, sometimes it's just too much of one thing. Getting baby moving and supporting their vagus nerve, their parasympathetic nervous system so that their body can effectively rest and digest are all really important factors. A baby isn't crying just to cry, they're telling us something. We can choose how we respond based on what we feel is going on. And there's lots of different um, ways to do that. But it's not just nothing, right? And what is that doing? So baby cries, and at 6 months they just stopped. So does that mean they just got better? Was the doctor right? Did they just get older and now they're better? No. A lot of times they're just getting used to that pain. And if you think of yourself as an adult, um, there's probably areas on your body that if somebody goes to touch, you're like, wow, that's really tight. That hurts. But your body wasn't even registering it because it had become accustomed to it. So our body is a beautiful thing, right? So no, it didn't just get better, like something changed. I hope this helps you if you're watching this. I'm sure it can be hard to hear that, oh, colic wasn't just them crying, it's them trying to tell me that they're in pain. And the doctor told me to do nothing. So I did nothing, which what else are you supposed to do? We're supposed to be going to our doctors as somebody we trust and listen. So if you're feeling like, well, I can't afford a feeding assessment, or my doctor won't refer and I can't get a different doctor in your area, then what I will say is start with the body. Move the body, get in the mouth and try to decrease that tension. People who don't have access to a personalized or private support is the reason I created the guides I created. They're movements to get the body in a better state. And that is the perfect place to start, because once you start, you can make changes and build from there. And I post lots of free information talking about allergy intolerances, and I do blogs for people. And so reading that information may help you troubleshoot on your own. I hope that was helpful. And you're not alone.